General pathology was first. So we talked about types of necrosis. This is pretty simple to grasp. Cell swelling and hydropic degeneration are, again, parts of reversible cell injury. Okay. Necrosis. Okay, maybe not. Because here it says that the cell size during necrosis is enlarged, and then the cell size during apoptosis is reduced. That's strange. And then there's pycnosis, karyorrhexis, karyolysis, and necrosis, and then apoptosis is the cell nucleus fragments into nucleosome-sized fragments. Blah, blah, blah. Microscopic changes happen before the changes are apparent and visible to your eye. And there's many different types of necrosis: coagulative, liquefactive, caseous, gangrenous, fat, and fibrinoid. Okay, coagulative is the most common type of necrosis. The cellular architecture is maintained. Happens in any tissue or organ except the brain. It's caused by oxygen poor situations and some toxins. Hypoxia is a decreased oxygen content in tissues. Hypoxemia is decreased oxygen content in the blood. Ischemia is decreased perfusion or blood flow to a tissue or an organ, like an artery occlusion or blockage. And an infarct is a region of ischemic necrosis. So the gross appearance of coagulative necrosis is the tissue is going to be pale tan to gray, and it's going to be dry. There's not going to be any crumbling or a gooey liquid center like in liquefactive necrosis. But yeah, it's just kind of the tissue looks dead. Like if you see a healthy kidney, it's going to be red, right? Well, this picture here, there's like a spot that's kind of tan. I'll just show a picture, I guess. That's coagulative necrosis. All infarcts are coagulative necrosis, but not all coagulative necrosis equals or is an infarct. This could have happened due to antifreeze toxicity in a dog. And then next we have another kidney. It's very, very telltale. You can just tell, that's coagulative necrosis. The other stuff looks different. Blah, blah, blah. Okay, on to liquefactive necrosis. Like the tissue turns into liquid. It's disgusting. It's the most common type of necrosis in the CNS, central nervous system, which is the brain and the spinal cord. But if you've ever had a zit or an abscess, that's also liquefactive necrosis because the neutrophils are swarming to that area and they're dying, literally. So that's necrosis, and it's a liquid, so it's liquefactive necrosis. Neutrophils, not only that is the reason, but they release hydrolytic enzymes, which means they turn the surrounding tissue into liquid. That's why it's liquefactive. But that is a classic example. Bacterial infections is a classic example of liquefactive necrosis. Yeah, zits. If you've ever had a zit, that's liquefactive necrosis. Onward, yeah, it happens in the brain and spinal cord. It's literally like, here, that's what it looks like. It can be less apparent, as in that second picture, and that's the histology slides right there, or histologic appearance to the right. The cells on the left or on my left, it was mirrored on the screen, but they were more close together, whereas the ones on my right were spaced apart. Do I do song requests? If so, HH by Kanye. HH, what is that? No, I'm not gonna play that song. If it's rap, nah, I'd rather not. This one is specifically in horses. Okay, so leukoencephalomalacia versus, what was the other one? Hold on, I gotta. Polioencephalomalacia. So polio is referring to gray matter. Encephalos referring to the brain, and then malacia is referring to soft. So literally the gray matter in the brain went soft. Polioencephalomalacia, liquefactive necrosis. Versus leukoencephalomalacia. Leuko means white matter, or is referring to white matter. Like you may have heard of leukocytes, white blood cells, right? Encephalo, again, means brain. Malacia means soft. So the white matter in the brain went soft. Pyometra is an example of liquefactive necrosis. That's literally, pyo means pus, and then mitra means uterus. Hey, CSFO land. So pyometra, pus in the uterus, gross. And then cat abscess. Any abscess or any pus is liquefactive necrosis. Next, caseous necrosis. It literally means cheese. Oh my goodness, you may have had in the past a zit where it's been there for long enough and then you squeeze it out and it's like cheese, right? That's caseous necrosis. It's liquefactive necrosis that has brewed for a little bit longer. Hey, Imran. It's basically a combination of coagulative and liquefactive necrosis. It can be crumbly. It's just cheese. It's okay. Here's a picture. Other than that, that's pretty much all there is to know about caseous necrosis. Chronic infections can cause it. Lymphadenitis or lymphadenitis, tuberculosis, That's an example. And it happens more often in birds because birds don't have neutrophils, they have something called heterophils. Okay, next, gangrenous necrosis. Frostbite. Yeah. You're my biggest fan? Well, thanks. Gangrenous necrosis is essentially dead, decomposing tissue, but on an animal that's still alive. Pretty gross. There's two forms. There's wet and dry gangrenous necrosis. The dry form is like almost mummified and it's leathery. The wet form is the same, but it's got a bacterial infection on top, basically. It can be red to black colored. Pretty gross. Frostbite. Again, that's one of the most common examples. Whenever I think of gangrenous necrosis, I think of putrefaction. It just begins to putrefy. That's basically all there is to talk about that. So next is fat necrosis. It's whenever it's the necrosis of fat, literally. And the fat just turns into soap, essentially. An example is pancreatitis. And there's like chalky white deposits. That's those like little spots of soap. It's really weird. But next is fibrinoid necrosis, or fibrinoid. It's not really visible grossly, which means not with your eye, but you can see it under a microscope histologically. Yeah, very, very gross. Okay. Now on to physiology. Okay, so honestly, in my opinion, it was just yapping for an hour, pretty much, talking about stuff we already talked about. But we talked about the filtration fraction, which is the glomerular filtration rate divided by the renal plasma flow. Filtration fraction is essentially the amount of plasma filtered through the glomerulus, or glomerulus, however you want to call it. Blah, blah, blah. Hydrostatic pressure, yep. Honestly, like, I'm having trouble in this class because it's just a lot of equations and stuff for some reason. It's physiology. It's not, I feel like it's not supposed to be math, but okay. Renal blood flow, auto-regulation of renal blood flow and glomerular filtration rate. This is like, yeah, it's just equations and stuff. Auto-regulation. So why don't we pee ourselves away? If we're always urinating, and if we don't have access to water, why don't we just turn into beef jerky? Why don't we just, you know what I mean? The reason why is because the body does something called auto-regulation. It basically uncouples renal function from arterial blood pressure and ensures that fluid and solute excretion is constant. Blah, blah, blah. Graphs. yeah, as you get more dehydrated, your body retains water. As you get more hydrated, your body excretes more water, especially if you overhydrate, which, as long as you don't do it too quick, you'll be fine. You'll just pee out water, essentially. Glomerular filtrate, blah, blah, blah. Urine is just waste, pretty much. It's filtered plasma, and it's the filtrate from the plasma in your blood. That's what urine is. It's the things that your body doesn't want, pretty much, or that your body doesn't need. Blah, blah, blah. Goodness. Yeah, your body will reabsorb things that it needs more of. All sorts of stuff like that. There's plenty of hormones that help. Amino acids, your body keeps. Glucose, your body keeps. Those aren't going to come out of your urine. And the reason why there's no glucose in your urine normally is because your body reabsorbs it all. But there is a possibility of there being glucose in your urine. How tall am I? I think last time I checked I was 5'10". 5 feet 10 inches. So glucose, there is a filtered load where if you pass that, say you've got type 2 diabetes or you have kidney damage, then your body's going to get rid of glucose. I assume it can also happen if you just eat way too much glucose as well, because glucose is toxic in your blood. That's why it's so finely regulated in your blood. You're 5'3", that's cool. That's honestly, I'm pretty sure that's average, isn't it? But it happens as a result of tubular cells not being able to absorb filtered load anymore. And again, it happens in type 2 diabetes or kidney damage. And probably if you just eat too much sugar or carbohydrates. You're very short, people bully you. Sorry to hear that. Don't let it get to you, man. Just don't bully back. That's what I'd tell you. You are just the way God made you. I can tell you that for sure. And don't let people bully you. If people do bully you, then just ignore it. They're gonna keep. I mean, I can tell you something for sure. They're probably gonna keep doing it. I mean, things like this don't happen overnight. But what you've got to do, in my opinion, is just be confident. You can't really change your height. You'll be okay, though. Just be confident. Develop other skills, you know? Maybe get super buff. Go work out. I know that shorter people can put on muscle mass a lot easier. You already did the limb lengthening surgery? Well, I wouldn't recommend that for sure, but if you already did it, then alrighty. Talking about the head in comparative anatomy. So, yeah, we're back to the skull and the horse and the bovid, or the bovine, or the cow. Um, Horses have a naso-incisive notch, an infraorbital foramen, and a facial crest. And all of these are useful for finding out where their nerves are. There's a finger spacing technique, which you then, if you're doing a nerve block, you have to kind of use these three fingers. You put your thumb at their facial crest, you put your middle finger at their naso-incisive notch, and then your pointer finger will be about where their infraorbital foramen is, and that's where their nerve exits. How cold is it over there? I am in Oklahoma. It's actually not that cold in here, but, well, I mean, it is kind of cold, and so I'm wearing this coat. But outside right now, I actually don't know. Okay, apparently it's 28 degrees Fahrenheit, so it's not that cold compared to Alaska. But I'm cold. I'm a little chilly. My hands are always cold. I hate it. But just something I got to deal with. I have hand warmers, electric hand warmers. They're pretty cool. My girlfriend got them for me. I'm very grateful. The pole of an ox, it's basically the top of the head, is the intercorneal protuberance. And they've got a big frontal bone. The ox does. Or the bovine. Or the cow. You know what I mean? And they have a completely bony orbit. Like there's no space like there is in the dog and cat, I believe. The ox has a temporal line, a zygomatic arch, and a facial tuber. Those are some of the landmarks on their skull. The pig has something called the os rostral, or rostrali. It's, they use it to like root around, you know. They'll move it when they're rooting around in the ground. And then there's the muscles of facial expression in the equine or the horse, equine. There's the levator nasolabialis, the levator labii superioris, the caninus or caninus, the depressor labii inferioris. The caninus or caninus dilates the nostril. And then the levator labii superioris, levator labii superioris helps the horse with the flamen response, which is a response that happens due to pheromones and stuff. In the ox has the frontalis muscle up here above their eye. You know, they can raise their, I think that's what helps us raise our eyebrows, the frontalis muscle, or frontalis, I don't know how you say that. But they also have a levator nasolabialis, a levator labii superioris, a caninus or caninus, depressor labii superioris as well. They've got pretty much all the same muscles as the equine. The equine, however, has a nasal diverticulum, which is like a blind pit or a blind pouch in their nose. So if you're trying to pass a nasogastric tube, you don't want to go in that blind pouch because that's not the nose, right? I mean, it is part of the nose, but it's, you know what I mean. The pig has a big old parotid salivary gland. Their parotid duct is below their masseter instead of along their masseter like in the dog. The masseter is this muscle right here. You can kind of see it whenever I clench my teeth, which I don't like clenching my teeth. It kind of, I mean, it's not really good for your teeth. But anyway, yeah, like it's this muscle. Whenever you chew, you've got a temporalis muscle, masseter muscle. You've got a couple more. I think there's some down here. Digastricus, I think, is the one down there. Yeah. And there's a lot of nerves in the head, too. There's a dorsal and ventral buccal branch, and then the auriculopalpebral nerve. In the horse, it kind of goes this way, the auriculopalpebral nerve, in relation to their ear. But the dorsal and ventral buccal branch go along their masseter. So, like they've got the dorsal meaning to the top, and ventral meaning to the bottom, buccal branch. Then we have the trigeminal nerve. They have plenty of branches of that. Infraorbital, inferior alveolar, supraorbital, and then mental nerves. The ox also has a dorsal and ventral buccal branch, but their dorsal branch goes over their masseter and their ventral branch goes under their masseter. The trigeminal nerve, they have a cornual nerve, an infraorbital nerve, and a mental nerve. And then there's the arterial supply. The oxen or cattle, they have arete mirabile as well as cats do. That's kind of like in their skull. Blood supply to their brain, sort of. It's around their eye, basically. It's deep in there. You can't see it on the surface. Yeah, that's how they get blood supply to their brain. But it's different in horses or equine. They have a transverse facial artery, they have a masseteric artery, and then they have a facial artery. The facial artery kind of goes this way, I think. It's a little deeper than what I'm showing, but and then the masseteric artery goes to their masseter. And these animals have big masseters because they're eating all the time. And then the transverse facial artery is kind of below the eye. And then they have a parotid salivary duct as well. And the ox, they have a facial artery, a cornual artery. Yeah, and then there's venous return. It's pretty much in the equine, it's pretty much the same as a dog. They have the deep facial vein, the buccal artery and vein, the transverse facial artery and vein. Yeah. In the ox, or cattle, or cows, I try not to say cows because a cow is a female ox, right? A bull is a male ox. Cattle, they go moo. Venous return, the frontal vein in the ox as exits through the supraorbital foramen. And then in the pig and the ox, you have an auricular vein literally on their ear. I mean, we have it too, but ours are very small probably. But theirs are so big enough to the extent that you can draw blood from them. They also have a tail vein that's somewhat the same. We have a vein in our sacral vertebrae segments probably, but again, it's small and most likely vestigial, since we don't have tails normally. But the in the ox especially, it's very large, very easy to get blood from. That's as a matter of fact, that's a preferred spot of blood draw. And then there's the teeth in the bovine and the teeth in the equine or equine. Equine have a wolf teeth, which is like premolar 1. Hey, Puat Quach, I hope I said your name right. Not all horses have them, though. Matter of fact, they're often removed if they do have them, because it's hard for a horse to use a bit if they have one. But then there's the difference between brachydont and hypsodont teeth. Brachydont are basically teeth that grow, and then once they're done growing, they stop growing. Hetero or hypsodont keep growing. And so horses and rabbits, animals with these kinds of teeth, need to either have their teeth shaved periodically, or they wear them down naturally just by chewing all the time. So very, very interesting. Here's a picture. Hopefully that makes sense. The weird one that didn't look like a normal tooth, that's hypsodont. Very strange, but it's real. And then, yeah, the reserve crown of the hypsodont tooth is found in the maxillary sinus, just in sinuses in general. Okay, that's it for comparative anatomy. And honestly, that's probably all I've got time for today, because I got to go to school this morning. But thank you all for watching, and I don't know. I don't know when I'll stream next. Maybe tonight? No, probably not tonight. Don't have time. Probably tomorrow morning, around this same time. Maybe a little earlier, maybe a couple hours earlier. But, yep. Thanks for watching. See y'all later.